Hello, everyone. This is an educational presentation with the Skin Cancer Prevention and Identification Program, focusing on skin cancer, specifically melanoma. This is presented by Sarah Ratner, and this is for Purdue University as a Master's of Public Health candidate. First, we're going to start with what is melanoma. So, melanoma is the most serious form of skin cancer. It develops in melanocytes, which produce melanin and give skin its pigment. Most commonly develops in the skin, but can also initially develop in the nose, GI tract, or oral or genitalial mucosa. There are four main types of melanoma: superficial spreading melanoma, or SSM, lentigo maligna melanoma, LMM, acrolentiginous melanoma, ALM, and nodular melanoma. If left untreated, melanoma can and will cause death. As you see on the right-hand side, it shows the four different types of melanoma and how they look a bit different and where they're more likely to grow on the body. So the causes of melanoma. So melanoma occurs when there are mutations or irregularities within skin cells. And this occurs when there's the division of melanocytes, which happens on a daily basis. Your skin is always reproducing and creating more skin cells as we constantly shed our skin cells. So melanoma occurs when cells develop with damaged DNA, and then they're unable to regulate to know when to stop producing cells, when cells are not necessarily performing the best, or when there are issues within the cells. So when cells begin to grow out of control, it forms a mass of cancerous cells, which is melanoma. So the exact cause of cell damage that leads to melanoma is unknown. It is assumed that it's linked with infrequent but strong sun exposures that result in a very, very bad and drastic sunburn. That's different from other types of skin cancer, such as squamous cell carcinoma and basal cell carcinoma, which are linked with more sun exposure over a longer period of time, not necessarily always leading to sunburn, but if you're sitting out in the sun for, every morning drinking your coffee on the porch, you're more likely to get a basal cell or squamous cell carcinoma, which are superficial forms of skin cancer. Melanoma is a more deep type of skin cancer that has a very much higher risk of metastasis. So melanoma can also be caused from UV radiation from tanning beds and also just normal sunlight. And then there are also other risk factors that contribute to a heightened risk of melanoma that I'll discuss more in depth on the next page. So the risk factors of melanoma include, like we said, exposure to sunlight or UV radiation. Also, you're more likely to develop melanoma if you have a condition that causes defects in DNA, such as xeroderma pigmentosum. Individuals with a weakened immune system, such as having a comorbidity of HIV, or if their status post-organ transplant. If you're over the age of 20 years old, females are also more likely to develop melanoma, and individuals with a lighter skin complexion who are highly freckled with blue or green eyes, and additionally blonde or red hair are more likely to develop melanoma. Also, if you have the inability to tan and you frequently burn, and if you have a history of sunburns, if you have numerous moles growing on your body, benign ones or cancerous ones, you're still more likely to develop melanoma in those pigment cells. If you have a family history of melanoma, because there are some genetic factors that make you more predisposed to developing melanoma. And also if you have a personal history of basal cell or squamous cell carcinoma, those other two forms of skin cancer that are more superficial that we previously discussed. So distribution of the lesions. So in white females, you are more likely to get superficial spreading melanoma on the upper back, lower legs, between the knees and ankles, and the arms. If you're a white male, you're more likely to get SSM in your upper back, anterior torso, and upper extremities. You're more likely to get LMM in your head, neck, and arms, and the nodular melanoma is more likely to form in the legs and the trunk area. African Americans or people with dark skin complexions and Asians are least likely to develop melanoma, but they are more likely to develop ALM, which occurs in non-sun exposed areas. So there's more of a genetic component or another component that we don't exactly know so far in our medical research. But these areas are more so like the soles of the feet, the palms of the hands, nails, and nail beds. These are known as mystery or mystery melanomas, or areas that are not technically or usually known to develop or prone to develop melanoma. So first, what are the symptoms of melanoma, and how can you make sure that if you do notice any of these symptoms, you are able to identify it as a potential melanoma? So the first signs and symptoms are a change of an existing mole, the development of a new pigmented spot, or a spot that just looks different in size, shape, or color from other areas on your skin. There's the ABCDE rule, which is a guide to help you identify the usual signs and symptoms of melanoma. So the ABCDEs of melanoma stand for asymmetry, border, color, diameter, and evolution. So asymmetry is if one half of the mole does not match the other half of the mole, as you could see in the image below. For border, it's if the mole's borders are uneven, raised, or not clearly defined. And as you can see, there's that image below as well. For a color, the moles will be multicolored, usually with a very, very dark pigment that is black or brown, and sometimes even there are some red spots and areas thrown in there. For diameter, moles that are larger than 4 millimeters or 0.25 inches and are growing more rapidly than other moles on your body. And lastly, evolution. If you notice that there's a spot on your skin, but then over, weeks, months, years, you notice that mole starts changing in size, shape, color, or texture, that is a giveaway sign that that area is potentially a skin cancer. So to develop and understand how professionals and healthcare providers stage melanoma and determine your prognosis and chance of survival from melanoma, they use two different scales. One is the Clark's level scale, which is there to determine the grade or the stage of melanoma. So grade 1 is considered to be in situ, or it's only in the top layer of your skin, known as the epidermis. If it is grade 2, it's in the papillary dermis. If it's grade 3, it's in the filling papillary dermis. If it's grade 4, it's in the reticular dermis. And if it's made it all the way to stage 5, that means it's in the subcutaneous fat. As you can see on the right-hand side, these levels correlate onto the Breslow's measurement scale, and this determines the thickness of the tumor. So basically, if you have a tumor, and this is how it's done once they take an initial biopsy, they biopsy the area, and when they're looking at it under the microscope, they're able to see the tumor thickness. So if it's less than 0.75 millimeters, it's known as stage 1, or it's just in situ. If it's 0.76 to 1.5 millimeters, centimeters, it is going to be grade 2, and so on, as you can see in the scale and chart below. So the survival rates are also listed on the right-hand side of your screen. So obviously, the earlier you catch melanoma, the better chance you have of survival, and the least invasive it is. So the further you go down on this and the higher in grade that you get, that means the more chance there is of metastasis, secondary lesions, and it expanding into lymph nodes and other organs, including the brain, spinal cord, lungs, and diaphragm. So here are just some statistics overall about melanoma. So for the death rate of melanoma by race and ethnicity, excuse me. So males are more likely to die from melanoma. So it is more common for females to develop melanoma, but they have a better prognosis. This is not exactly known why, but as you can see here, that white males have the highest rate of death by melanoma. And it decreases as you go down for people who have darker skin colors. So African Americans are the least likely to die from melanoma. Not saying it never happens, but they are significantly at a lesser chance for this to occur. If we flip over to the chart on our right-hand side, it shows us the incident rate or the prevalence rate of melanoma skin cancer. So in the United States, you can see we would expect that areas where the sun is highest and you're closest to the equator would be the increased risk of skin cancer, but it actually isn't the case. It's from the areas that don't necessarily get sun year round. So the assumption is that when it is nice weather out, the individuals living in these areas, such as Washington and Oregon and up in New Hampshire and Vermont, they tend to sit out for those times that we discussed earlier. So it's less frequent sun exposure, but when they do get exposed to that sun, it is more intense and they get stronger and worse sunburns, which is what causes melanoma to develop rather than a basal cell or a squamous cell. Moving on, so the treatment for melanoma really depends on the stage and severity of the disease. So if you're anywhere in stage 0 or stage 1, you would mainly or just so have a wide excision done. This can be done by a general surgeon, a plastic surgeon, or a dermatologist. So what they do is they go in and they just excise your skin and the area that contains the melanoma down to the subcutaneous layer. And they do a wide excision, so they do about 0.5 to 1 centimeter larger margins than what is visible on the top layer of the skin. Um, if the cancer is suspected to have spread, the next step would be to do a lymph node removal to see if it has traveled to the lymph node, which would be the secondary area that it would travel to. Next, we'd move on to immunotherapy, targeted therapy, and then in worst cases, it would be that radiation and chemotherapy would be necessary to irradiate the cancer if it has spread to other organs. So for prevention, this is the most important part for this educational presentation. So prevention. Skin cancer is very, very, very avoidable if you take the right steps and precautions. So first, you need to limit and avoid sun exposure, especially during the hours of 4 a.m. Of 10 a.m. to 4 p.m. Schedule outdoor activities for other times of the day, or and even when it's winter or cloudy out, the UV rays from the sun still do get down to earth and penetrate through our skin. The next step would be to wear sunscreen. So sunscreen is super, super important. It is always recommended that any day you go out, any exposed area of skin, you have an SPF of at least 30 on. You want to apply sunscreen, especially when it is summer or those months where the UV index is extremely high, that you reapply and generously apply sunscreen every 2 hours, and even more frequently than that if you're swimming or sweating, as the sunscreen sweats off your body. Next, you can wear protective clothing. So that includes covering your skin with dark, tightly worn clothing, especially that covers the arms and the legs. And additionally, you can wear a broad-rimmed hat that helps protect your scalp, face, neck from the sun exposure. Next, best thing you could do is avoid tanning beds and lamps altogether. These emit the UV rays that are same from the sun, and it increases your risk of developing melanoma and other skin cancers. Next, you're going to become more familiar with your skin. So examine your skin every so often. Be more comfortable and with your skin so that you're able to notice changes in moles, freckles, lumps, and birthmarks, as changes in those areas can be a sign of early warnings of skin cancer. And lastly, you want to go for annual skin checks with your dermatologist. A dermatologist will provide and do a total body skin check where they really do check you head to toe, make sure that they don't see any areas that look suspicious that someone without medical training would not be able to point out or identify. These annual skin checks are usually covered under most insurance plans. And additionally, if you do not have insurance, a lot of dermatology offices will offer a discounted rate for these annual skin checks, as it is a preventative health measure and very important within the field of public health and healthcare in general. That is all that I have here. We're excited for what helps me to create this presentation today. As always, if you have any questions, feel free to reach out. There are other aspects of the skin cancer identification and program here, as well as some flyers and an Instagram page. So feel free to reach out if you have any questions or concerns.